welcome to my YouTube channel Lab Wellness Tip. On today's episode we are going to have Sam, who is a radiographer, and is going to educate us about the radiography unit. He's going to educate us about the X-ray unit, the CT scan unit, and the MRI unit. So stay tuned.
Hello, I'm Sam, a diagnostic radiographer by profession. I work with the X-ray, CT, and MRIs. Those are my specialties, even though we have a broad range of specialties. But I basically work with the X-ray, CT, and then MRI. And so you find me in the radiology department. So with the X-ray, we use X-rays in imaging. Okay, so when you come into the X-ray department or the radiology department in general, I would like to talk to you in two broad areas: safety aspect and imaging. Most of us have this misconception about the radiology department being a very dangerous area. Yeah, it is. But then you need to know how to navigate your way when you come around. So the X-ray uses radiation and imaging, which is harmful. Okay, but then we only do it when there is an indication. So if you are coming into the X-ray department or the radiology department, it's because your doctor wants you to do a procedure that will help him diagnose a disease. Okay, so even though it is harmful, you will still have to undergo the procedure. And that also brings me in. So I'll have to make sure that I acquire the images whilst keeping you safe. Okay, so I don't just put you in radiation, bombard you with any amount of radiation. Okay, so I have the duty of protecting you. Okay, so I have to justify the procedure, make sure you are coming in for the procedure that is needed for a diagnosis. Okay, and then I also make sure that I use the minimum amount of radiation possible to give good diagnosis. So that's what I do. So as a professional, that I have to justify and make sure that I keep you safe whilst giving you accurate diagnosis. So for X-ray, it's a two-dimensional imaging. It's just like a phone, how you look at a picture. Okay, so you are not good to see into it, but you might do X-rays for every part of your body, from your head to your toe. So it's basically it's good at looking at the bone tissue. Okay, so if you are involved in an accident and then you have a fracture, a broken bone, if I say that, the X-ray is the first line of imaging, so that will see the extent. Okay, and then when that is achieved, you might also be requested sent to do a CT. So the CT is just like the X-ray, okay, but then the CT gives you a three-dimensional imaging. So what I mean is you're able to see into the part. So for instance, you have an accident, you break a bone, your leg. Okay, you take an X-ray, you might see that there's a broken bone. Okay, but you want to see the extent. How far back has the bone pushed? Is it pushing in on your skin? Is it causing any other damage inside that part of your body? So you might do a CT where you can look at it in those directions. So CT is a higher version of an X-ray. Okay, that is able to give you more detail. It has the advantage of giving you more detail, and then it's also good for surgical plan because you are able to do 3D reconstruction. 3D, I don't know if you've seen 3D printing. You're able to see. So we are able to model that from CT. So we can model your knee as a 3D so that you can move it around. So that helps in surgical plan. So if you have to go and do an operation, the doctors have access to that. That can help them plan and do the surgery. And also, in this part of our world, stroke is common. Okay, and you might also find yourself doing a CT if you have stroke symptoms, because that's the first line of imaging for CV, as stroke, it's okay. So if it's happening in the early hours, you might come in and just do a cerebral angiogram, a CT angiogram of the head, so that you pick out if there's any aneurysm or if it's a bleed tube, that's perfect. You see it bright over there, and then you can pick it up. And then if there's further imaging, then you might do an MRI, which I'll talk about later. Yeah. And then the CT, some also have other higher capabilities, okay, for imaging the heart, coronary arteries. Yeah, that's not common with all other machines, but then some are able to do that. So you know that you can't stop the heart from beating. So how do you image the heart?
Nice.
So other machines are able, they scan very fast. Okay, so we are able to image that. We look at the coronary arteries and see if there are any plaques in there, so we can pick them up. And then what other conditions? Yeah, you can image. You can do an abdominal CT as well, where you look at the bowels. Usually you might find yourself drinking some water in our department here. We just put a dye inside it so that it fills your bowels.
Okay. So you give that once to the clients?
Yes. So we call that contrast.
Oh, okay.
So it's just something you drink. It outlines your entire alimentary canal for a few hours, so that when you image, we are able to look at the entire bowel. Apart from that, for liver pathologies, for as I see here, and for fractures, or RTS in general, might come into that.
So what's of the MRI?
The MRI, yes. So the MRI is, as I mentioned, so the MRI, I would like to mention first that the MRI is a magnetic, it uses magnet to image. It's a huge magnet, if I should put it that way. So it attracts metal. So I have a duty of making sure that you are safe before you go in. So that is very important. We don't rush you inside there. So when you come the first line, what I have to do is make sure that you don't have anything that might be attracted by the magnet. Yes, so one other modality I work with is the MRI. Yes, so unlike the X-ray and CT I mentioned, the MRI is a magnetic area. It's basically a huge magnet put in the room. Yes, and as you know, magnets attract metals. So if you come in to do an MRI, one aspect is safety. So we have to make sure we screen you properly. So throughout the procedure, we might ask you to sit at specific places because we don't want you to be close to the magnet at a certain point when you have not been screened. So you might be asked before the scan to sit at certain regions. It's deliberate. We want to screen you properly before you move closer to the magnet. So if you come into the MRI, we have zones. Zone 1, that's far from the magnet. We have zone 2, which means you are drawing closer. Zone 3, that's where I work. So we are not even supposed to come there. And then zone 4, that's inside the MRI. So the closer you are to the magnet, the higher the risk. Okay, so we don't want you to get closer without being screened. So once you come in, I have to screen you. So part of the screening process is giving you a questionnaire to fill. I'm supposed to fill it thoroughly. And as a duty of care, I have to make sure that you fill it. It's my responsibility if anything happens. So I have to make sure you understand every single piece of information there and fill it adequately. So yes. So in terms of safety too, there are certain metals that you can send into the MRI. Not every metal is magnetic. Okay. Yes, so during the screening process, if you've undergone a surgical procedure where you have an implant in your body, then we have to further investigate what type of implant it is. No assumptions here. So I have to find out from your physician, the one who did the operation, what implant that is. Okay. If it is titanium, which is MRI friendly, MRI safe, we can put you in there. Okay. If it is something made of bronze, steel, then we can put you in there. You might have to do an alternative procedure because it will present as a risk. Okay. Yeah, so that's part of the screening process. You have to make sure you don't have anything mental on you. Okay. Yes. So once you are done screening, and then we are sure you are safe to go in, one other thing to that we'll do is we'll make you change. Okay. It's just still precautions. You might forget your key in your pocket. So we do have people saying that, I don't have any metal on me, but then this you have to bear with that. We just want uniformity. So we might still be asked to change into the hospital gown, which is compatible with in the MRI. Then once you are screened and ready to go in, then we take you into the zone 4. That's when the magnet is. Okay. So the magnet design is there are different types of designs. Okay. But the most common one is designed like a ball. It's a hollow ball. So we do face people. We do face a challenge with people that are claustrophobic, that's scared of closed spaces. Most people say it's like a coffin, and yeah, it's true. It's a hollow ball. We push you inside, and yeah, you are enclosed, looking at the top of the ball. So, that's a challenge we face with patients. And we do not force people to go in. We just have to, we play a psychological aspect. We have to make sure that we explain things to you, that you are safe in there. Some people relax and they go in and do it. In adverse situations, we have to give sedation. Give you something to knock you off and make you sleep, and then we get the standard. How are we doing that? We get the doctor to do that. And then during the scan, you might hear some loud noises. Loud noises during the scan. That's also normal. During imaging, you do hear those sounds. So we give you ear protection to just minimize the sound. And yeah, that's it. So you are expected to just lie in the ball. You lie still. You are taking pictures, so you don't have to move during the scan. So you lie still throughout the procedure and give you ear protection. And then there's a mode of communicating with the technologies. Okay. So you are not just there, So the person explains departmental protocol. They will let you know how you are supposed to communicate. But usually it's a buzzer they put in your hand. You press to let them come in. So once you press it, you have to come in and check on them. So it's very safe. The only risk is the magnet. You don't have to send anything metallic inside. Okay. Yeah, it can. Yeah, that's the risk. But in terms of safety to the patient too as well, it's safe. Unlike radiation. Radiation is harmful, but MRI is very safe. We even do MRI for babies in the womb. That's fetal MRIs. Okay. So there will not be any established risk to the patient from MRI imaging. Yeah, so safety-wise, MRI is very safe as long as you don't have any MRI unsafe object on you. You are safe to do.
Okay, so Sam, can you give us some importance of the MRI? Some of the tests that can be run on MRI.
MRI, yes. So let me start with the brain, because that's most of the scans I get. We do a lot of brain scans,
brain tumors.
Because we have a lot of severe, that's stroke patients.
Stroke patients, yes. Okay.
Yes, so we do a brain MRI to look at
Okay.
the extent of damage in the brain when the person experiences a stroke.
Okay.
If it's in the early hours, you do a CT.
Okay.
Hyperacute stroke.
Oh,
you
nice.
you do a CT. Yeah. You can pick it up first. But then if it's a delayed one,
you
then
do
you
the
have to do
MRI.
an MRI.
Sure.
That one will be able to give you the extent of should I say damage, cerebral damage.
Okay.
In the brain. Then it's also good at looking at tumors.
Okay.
Yeah, if I mean, people present with headaches and all that, so you might do it and then maybe it's a tumor, brain tumor.
Sure.
Okay, so because MRI is basically good at looking at soft tissues.
Thank you all for watching today's episode on my YouTube channel. Thank you all. I appreciate each and everyone watching my videos on YouTube. Thank you all, and please hit the subscribe button now. Let's dive into the world of lab wellness together. And comment, please do that. Comment and share this video. Comment and share this video. I am BMS Asantua. I am a medical laboratory scientist. Thank you all for watching this video. Bye bye.